Respecting everybody's time, and we're so glad that everyone is here to be with us for this exciting announcement. And so to get things started, I want to introduce Mark Murphy from St. Joseph's.
Good morning. This is an exciting day for St. Joseph's, Trinity Health, our community partners, and mostly the community of Syracuse. We are here to announce that St. Joseph's and our partners have received a Transforming Communities Initiative grant from Trinity Health for $500,000 per year for up to 5 years to work together to improve the health and well-being of our community. It is my pleasure to introduce to you Dr. Bushara Shukair, Senior Vice President of Safety Net Transformation, Community Health for Trinity Health, to share more about the Transforming Communities Initiative and why Trinity Health is investing in Syracuse. Dr. Shukair is responsible for working directly with Trinity Health Regional Ministries to improve the health of population and impact community-based social determinants for health. For 5 years prior to joining Trinity Health, Dr. Bushara has worked as a commissioner of the Chicago Department of Public Health. There, he and his team launched Healthy Chicago, the city's first comprehensive public health agenda. Dr. Bushara.
Thank you, Mark. Good morning, everybody, and thank you so much for being here. So, I thought I'll share with you 3 things today. The first thing is, fundamentally, as a health system, we truly believe that health does not start within the walls of our hospitals or within the exam rooms between a patient and a doctor. We truly believe that health starts in our communities, and health really starts where our residents, where our community members play and learn and live and pray. This is really what health is all about, and that's why we wanted to make sure as part of this effort that we are out there in the communities finding and working with the right community coalition. So it's great to be here today with everybody. The second thing I wanted to share with you today is we also believe that if we truly want to transform communities and want to create healthier communities, we have to reach across other sectors that goes beyond health. And we need to be engaging with the transportation sector, with community development, with education, with housing. And when we bring all of those partners together, all of these sectors together, that's how we create the fabric of healthier community. And so we're so excited to be part of this effort here in Syracuse. And the third thing I wanted to share with you is when we've announced this Transforming Communities Initiative as a system, we've asked for all of our communities in all 21 states to apply and for this funding opportunity. And I can tell you we got great applications, and when I was reading the Syracuse application, I could feel the energy, I could feel the commitment from the community partners, the community coalition that's really been working on transforming communities for so long, that has track records, whether it's here in the near Westside or on the Northside or doing all kind of work with the health department and other sectors with the school districts. So you could feel that energy coming through that application, and I wasn't surprised when that application scored so high up and got selected. But I have to tell you that I've been here for the last hour and a half or so talking to all these folks who I've went to their website and read their bios and read about the work that they've done, and you could feel this energy 100 times better. I mean, you could definitely feel that this coalition is going to be making a significant, big difference when it comes to community transformation. So I'm really excited to be here today. As a system, we've really committed to making a difference in transforming communities, and we've selected 6 communities across the country. Syracuse is one of them. I look forward to see how that effort's going to translate down the line. And I'm so excited to be part of a health system that believes that health goes beyond the walls of a hospital, that we don't want to be just a health system that's treating illness, but we really want to be a health system that's creating health. And we cannot be creating health without partners like all of you here. So thank you very much. We're so excited for St. Joe's. We're so excited you're part of our family, and we're so excited to meet everybody here today. Thank you so much.
Dr. Shukera. As a member of Trinity Health, today is another example of your support for St. Joseph's mission to serve our community. As a member of Trinity Health, we are excited to be working with community partners who share in a common vision to create a people-centered health system, shifting the focus of healthcare, as you said, from acute care to a community-based collaboration that creates a healthy community. Thank you to our community partners who are helping us every day and will help us under this grant to understand our communities. The Onondaga County Health Department, Northside Up, the Lerner Center at Syracuse University, the Near Westside Initiative, and HealtheConnections. Together we will lead change strategies that educate, create, and sustain healthier communities by addressing tobacco use, physical activity, and nutrition. We will increase opportunities to favor routine, easy choices for healthy lifestyles in the Syracuse community. Expected community benefits include reduced rates of smoking, reduced youth obesity rates, improved access to nutrition and physical activity opportunities, fewer health disparities, and enhanced community wellness. Our long-term goal is to decrease chronic disease in the Syracuse community through policy development, environmental change, and lifestyle programs that promote healthy living. Whether it's advocating nationally against human trafficking or empowering community engagement, we share the same goal, people-centered care. I'd like to invite Dr. Indu Gupta to say a few words.
Thank you. Good morning. I am really delighted to be here today and partnering with St. Joseph's Hospital, especially Trinity Health along with Westside, in sharing the goal of transforming community initiative to enhance health of Onondaga County residents. So let me start with the definition of health I strongly believe in, which is so eloquently defined by World Health Organization decades ago in 1948. Health is a state of physical, mental, and social well-being, and not merely the absence of diseases and infirmity. And with transforming initiative, all of us have taken this definition to our hearts and joining in hands together to a reality, truly a reality. So Onondaga County Health Department has always been and remains very strongly committed to work in the neighborhoods where community members are disproportionately affected by many health conditions due to lack of physical activity, poor diet, increased tobacco use, violence, and so many other social issues. This is even more important when children are faced with these negative factors every single day. We know that nutrition is one of the very important building blocks of our lives for both adults and children alike. As a partner with St. Joseph's Hospital, we will be able to enhance our work with small retail venues and corner stores. We will support them in offering healthy food options, starting from similar example will be fruits and vegetables, grain and high fibers, and the list is long. Furthermore, we will also provide in-store marketing to highlight these foods. It means transforming community does start from there. We know that physical activity plays a very significant role in one's health. It is essential for prevention of overweight and obesity, many chronic diseases, and at last in improving longevity. Early start will help change the course of chronic disease. Therefore, we'll focus our efforts on enhancing physical activity opportunity for children are in the Syracuse City School District. We have been continuing to work with them and who have very limited access to these resources, as well as we continue to have our community engagement as we have done throughout the community. Let's talk about newborn. Similarly, for the life starts, the child is born. Nutrition is a very important part from the get-go when the child is born. And proper nutrition should start from birth. We know that research tells us that breastfeeding is the optimal form of nutrition for babies. Health department works with various communities in promoting breastfeeding. With this partnership, we'll be able to support, expand, and strengthen breastfeeding initiative in very high need areas, especially in population where English is their second language. So we will use many other means through interpreters and also engagement of community members to go into their communities and trying to learn how we can actually impact them. And going back to the thing which you had mentioned is, my journey in public health started from healthcare sector, from being a provider. And overall, when I took care of patients, it became very evident that unless we address these social determinants of health, unless we think of a way out of our offices as well as hospitals, we are not going to change the health of our community. So I'm very confident with this whole approach of transforming communities in collaboration with all our so strong partners will greatly improve health of our community. So thank you for this opportunity. We look forward to work with all of you. Thank you.
Thank you, Dr. Gupta. And now Dr. Castro, who is the Medical Director of Primary Care Center West, who has been for years bridging the traditional healthcare with community engagement as Medical Director of that Primary Care Center. Dr. Castro.
My fan club today, thank you. Good morning. As Bashar said, the excitement in the room, I can't tell you how honored we are to receive this Trinity grant. I've been fortunate to work in this community with a very passionate organizations, and this grant's going to really enhance our efforts. At St. Joseph's Primary Care West, which has been a stakeholder of the near Westside since 1994, we serve a vital role in the community and the health needs of the community. As a primary care physician for the last 17 years, I've had the honor to play a key role in the public health efforts to improve the quality of care and transform the system into a wellness and prevention-based system. Healthy living takes time and energy, yet many individuals, they struggle with what it's like to eat healthy. They struggle with the term, what exactly does healthy mean? And how do I stretch those already limited dollars? At the Westside Clinic where I work, we continue to build awareness of community resources that lead to a healthy lifestyle and access to healthy foods, especially through Paul No James and our Healthy Shopper Rewards program that we're very excited about. We will continue to provide primary care support to enhance collaborative efforts to make Syracuse a healthier community, and this grant will certainly push us even further to achieving that goal. Thank you again to Trinity Health.
Thank you, Dr. Castro. And now a few words from Martin Jacobs from the Near Westside Initiative to say a few words.
Thank you, Mark, and thank you, Trinity Health, for this amazing opportunity. And welcome to Salt Quarters, one of our many spaces in the Near West Side, and we're thrilled to have folks here and be able to host everyone today. For us, it's exciting to be a part of this coalition of partners. It's really been a genuine partnership for so long. It's existed for several years, and we've all been dedicated to improving our community's health through a really holistic approach. I really can't think of too many of the communities that we've seen in our travels. We're a neighborhood grocer, a hospital, the health department, and a university, and multiple community development organizations are working collaboratively to this level. And it's just an honor. We're thrilled that Trinity's really recognizing that through this grant and this new opportunity. Specifically for the Near West Side Initiative, our main contribution to this project is Moving on Main, an idea that was born several years ago when we saw high rates of obesity and diabetes and hypertension in our community and wanted to really improve the physical environment to stimulate movement and exercise here. Through lots of community dialogue, outreach, we really learned that to convince our residents to get out and to exercise, first we need to create a safe space where kids could really play while their parents could watch them and exercise. Mary Alice instilled in us early that to get adults out, it meant to get the kids out first, and to get kids to feel safe playing, and the adults would follow. We've really seen that to be true. So after a lot of intensive design and an intensive design competition, we landed on some really great designs and a vision to transform Wyoming Street, which we are along, into our neighborhood's main street for exercise. And phase 1 of that will begin this summer, just adjacent to this building. We'll be building an outdoor recreational space with exercise equipment for adults, play equipment for kids, all open 24/7 to the public. What the Transforming Community Initiative really allows us to do is to begin phase 2 of Moving on Main, which will just be 2 blocks away, right across from the Peace Inc. Center, which is really a great community center for our neighborhood, and WCNY, our local public broadcasting company, their new headquarters there. That vacant lot will be transformed into what we call Performance Park, which will be a space for the community to set up for farmers markets, community performances, and now through this grant, phase 2 of Moving on Main. And what that really means is imagining a place where adults can hop on an elliptical, kids can run around and play, our local yoga and CrossFit gyms can host exercise classes, and all that really being possible all in this one space in the heart of our neighborhood. So thank you for this great opportunity. Thanks.
Again, we want to thank Dr. Schuker and Trinity Health for their support that allows us to have a platform for community engagement to raise the health and wellness of the Syracuse community. We're excited about the opportunity and looking forward to continuing our work with community partners. So at this time, it concludes our presentation, but we'd be open to taking questions, our collective group, to take questions from the media if there are any.
Okay, great.
Mark, what's your title, Mark?
It's Senior Vice President for System Development.
Thank you much.
I know people talked about a lot of different initiatives. Is there do you have like a document that outlines the different projects that Trinity's grant will be